Morning, everyone. I'm Kent Richter. I had an awesome presentation planned. It was going to be about neurosurgery emergencies, and then I saw Dr. Pitt's presentation last week, and it was like Sherlock Holmes and orthopedic surgery becoming a better diagnostician, and it was super interesting and fun, and I scrapped my entire presentation and came up with something hopefully a little bit more interesting and more relevant. So today we're going to talk about neurosurgery and the ministry of healing. Just as an introduction, this is my wife, Meg. I'm Kent Richter. We live in Pennsylvania, usually. I'm a PGY4 neurosurgery resident there at Geisinger. Right now, we're doing a year of research here at the University of Utah with Dr. Ramesh Grandi. I don't know if any of you have met him, but he's a vascular neurosurgeon. So neurosurgery has a year of research built into it, so we took advantage doing a year here. It's been amazing. I met Dr. Edwards actually through a mutual friend at church, and I've had the opportunity, he invited me out to the Summit Conference in September and Tuesday rounds, and been in the OR with him and met his team, and seeing how he runs his practice and his team in and out of the OR, it's amazing. I've been kind of ruined for all other neurosurgery practices. I went skiing. I've had the famous lobster roll. I'm unable to go back. So I'm gonna finish at Geisinger and then come back here to Summit because there's no other option really. But yeah, this is my wife. We have 4 kids. Oldest is June, she's 9. Marie is 7. Hannah is 4, and Wynn is 2. And we have loved our time in Utah. It's been absolutely amazing. We love the mountains. We've come here often. Meg has family here. We both went to BYU. We visited during medical school often, so it's just been an amazing time. This is life at Pennsylvania. Still good, chaotic, but it's been amazing to have actual, time with the family. So anyways, the ministry of healing. I wonder if someone can read this quote for me. Yes.
Medicine is a ministry of healing, and healing is about connection. The rituals of medicine, touching, listening, being present, matter as much as the treatments we prescribe.
So I really like this quote. This is actually from a TED Talk. I can't remember what it's called. I think it's called The Doctor's Touch. It's by Abraham Verghese. Absolute amazing guy, amazing author. But I want to talk about the ministry of healing. Does anyone, when they think of medicine, does anyone immediately, yes, ministry of healing, does that pop into their heads? Or what do you think medicine is when you hear, ministry of healing, does that describe medicine for you today? Has that been your experience? I'm seeing some nodding heads. Yeah.
I would say I see kind of the ministry of healing a little bit more on some of the manual therapy side of things, like physical therapy.
Yeah.
And that's where I see a little bit more of that side of the involvement.
Perhaps there's more direct patient contact, communication, that sort of thing. Anyone else? Yeah.
I think you can make it what you want.
Yes.
I think it just depends on your attitude with your patients, the connection that you make with them, your mindset, maybe even day to day.
Yeah.
Is whether you're making a ministry of healing.
I agree with that. Yeah.
Yeah, just piggyback off that, I think there's a portion of that we can lose over time. My wife got a little heart-to-heart with me the other day and kind of come to Jesus, and she said, I feel like you're losing some compassion.
Yes.
In the way you're speaking.
Yeah.
Right? And it actually made me feel really bad.
Yeah.
I'm a very compassionate person.
Yeah, we believe you.
But, lately she's like, yeah, I feel like you're losing compassion. And it kind of was a reset for me. So I think it's a choice.
Yes, I absolutely agree. Anyone else up there? That's what I'm trying to get at, right? Is that I think we start in medicine and we're like, yes, it's a ministry of healing. Absolutely, I'm joining because I want to help people, I want to heal people. But then as time goes on, perhaps we get a little bit more jaded. We get bogged down with paperwork and just the administrative duties and just, the headaches of insurance and CPT codes and all of the rest. And this becomes less and less of a definition for for medicine or for our jobs, and perhaps more and more aspirational, but it might not be our experience. So, but I think we all started wanting to participate in the ministry of healing. Does anyone know who this is? Simon Sinek. Yeah, he's. Do you want to give a little background on who he is? You read one of his books or something?
Yeah, he is like a public intellectual.
Yeah.
He writes a lot of sort of science books.
Correct.
On self-improvement.
Yeah, exactly. He's kind of like a business thought leader. He went viral a couple of years ago after giving this talk called Start With Why. I don't know if anyone's heard that, but really good talk. And it's mainly about businesses, if they start with why, if they start with their core purpose, rather than focusing on what they're selling or how they're going to sell it. If they focus on why they're doing things, they'll be much more successful. They'll be much more distinguished within the business realm. And I think obviously this applies to us as well. If we focus on our why, we'll be much more successful as practitioners or just people in general. But I wanted to talk about why we chose to do, why we chose our jobs, and why did I choose neurosurgery? I've asked myself that question many more times after starting residency, like why on earth did I do this, than before, I think. And again, I think at the beginning we're like, yes, I'm a part of this ministry of healing, I'm a part of this team, and I'm going to make a difference. But as time goes on, there's a risk of forgetting that and of forgetting our core purpose and our why. This gentleman right here with the pacifier and the bowl cut, that is me. That's an iconic bowl cut. My brothers used to call me Lloyd Christmas growing up. So it's a treasured thing of the past. This is my sister, Anne-Marie. She's number 5 of 8. I'm number 6 of 8, so we were very close. We grew up doing all of the classic childhood things, bike riding and skateboarding and teasing each other, and we were really, really, really close friends. When Anne was 13, she passed away in the middle of the night from a ruptured brain aneurysm. And obviously no warning, no family history, turned our family upside down. Very, very difficult time. It was, anyone who's gone through something like that, you have a hole that's left in you and it can never be filled again. And that, for me, started the process of, well, why did this happen? What is it? I didn't know, what is a brain aneurysm? I was 10, and I was so confused about, life in general, but what's a brain aneurysm? How can this happen? And so that's kind of what inspired me I studied neuroscience at BYU, and then I applied to medical school, ultimately matched into residency, and nearly complete with residency. But that's kind of like my why. That's my core purpose, is helping alleviate pain of both patients, but also of patients' families who go through these horrible crises in their lives. And so I guess I want to talk a little bit about, and if anyone has any idea of how they go from how to find their why in practice, how to avoid burnout, how to avoid, I just kind of like becoming burdened with the everyday tasks of running a practice or being in healthcare. Anyone have any suggestions about that? How to avoid burnout? Yes?
I think a lot of it comes back to your initial quote on the
Exactly.
connection piece.
Yeah.
When I felt the most engaged in medicine has been when I've been the most connected to people I work with.
Yes.
And to the patients. And the times I've probably felt the most burnout and the most frustration with it have been when I've focused on all the other things. And you have to spend time being cognizant of the things that allow you to connect with patients,
Yeah.
connect with the people that you work with. So you can't just ignore them. But it's part of this whole puzzle. But staying connected to the people you work with and to the patients is probably the most energetic way to go.
I think absolutely.
The energy they need to keep going.
it's the people, it's the relationships. It's the same with family. It's the same with kind of anything in life. Relationships are always what kind of, keep us grounded. But yeah, you obviously can't, you want to focus on the why, but you can't just focus on that. Obviously, you're going to have to take care of the what, the details, and you're going to have to focus on the how. But I think it's important that we don't lose sight of the why. And so I wanted to share just a few experiences that I've had in residency so far that have really helped me feel like I'm in this ministry of healing and fulfilling my core purpose or my why. The first is, I don't know if you know this, but Pennsylvania they host the Little League World Series. And it's like an hour away from Danville. Super fun. I get this particular case, I was an intern. I'm still learning. I was taking night call. And if anyone's taking night call at the hospital, there's like this controlled chaos. It's very stressful. And the ED texts me and they're like, hey, we have a kid coming in from the Little League World Series, head bleed. And I'm like, okay, whatever, it's fine. ED always texts about, heads up, making sure that and it's usually just like a tiny little fracture with maybe like a traumatic subarach or something like that. Nothing to worry about, just observation. And then the trauma intern sends me a CT scan, and I'm like, okay, this is not a routine consult. I just sprint to the emergency room, sprint down to the trauma bay. He's GCS3, it's a 12-year-old kid, GCS3, blown pupil, not good. And I immediately call my chief, and I'm like, this kid needs surgery. Stat, we're starting to whisk him off to the OR, and his dad comes into the room, and just, you can see in his eyes the panic and the fear. And I had to talk to him, and he's like, is he gonna be okay? As any parent would, what's gonna happen? And I had to look at him and just be like, we don't know, I don't know, but we're gonna do everything that we possibly can for him. And he did great. We got the blood out, and he immediately, after we stopped sedation, after we held, stopped the anesthesia, he woke up, he followed commands, and I was so relieved. And you could, again, his mom and dad were there, and just the relief that they had from seeing their son, wiggle his toes and give a thumbs up was remarkable. And like a year later, he's playing baseball again, and so that was like one of the core experiences of my residency so far, where I'm like, yes, this is indeed worth it. The thousands of consults, whatever, the annoying paperwork. That experience, really resonated with me. The next case was a 45-year-old male. He was in his barn, climbing a ladder. Somehow he fell off, hit his head. He was down a long time in the field. He was intubated in the field. He arrived at Geisinger, and we got a CT scan, and it did not look good. You can kind of see here these wedge-shaped hypodensities, which are kind of a sign of anoxic brain injury. He had a spot sign there, which is a sign of active bleeding. And we got the repeat scan, and the writing was on the wall. This guy was not going to make it. He had a horrible injury. And we're wheeling him back to the room in the trauma ICU, and his wife is standing there, and his 3 oldest kids, he had 6 kids, they were actually LDS, which is weird in the middle of nowhere, Pennsylvania. But his oldest son was about to serve a mission, and I sit down with him to have this horrible conversation that her husband, their father's, he's not going to make it. And I know many of you have had difficult conversations like this, but I'm just praying the whole time, what can I possibly say to help this family during this horrible time? And somehow, was able to get through it, and through a lot of tears, the wife is thanking me, and the children are all just kind of rallying around their mom. And we weren't able to save the patient, but I was able to help this family, through this crisis of their lives. And again, deeply resonated with why I'm doing this, and why people who helped me and my family during my difficult time. A lot of memories of that came forward. So the last case is a 32-year-old male who was in a horrible MVC, bad injuries. He was hemodynamically unstable. He had a massive fracture dislocation of his spine. He was basically like split in half internally. You can see this is his spine here. This is, it should not be separated like this. These should be together. And it was such a bad injury that his thecal sac was ripped. He was pouring out CSF. Yeah, it was actually, he formed this CSF pulmonary fistula, which I'd never heard of. I didn't think that was possible. And so he's leaking CSF into his lungs, and it's causing respiratory distress. And we couldn't operate on him immediately, but he was decompensating because of this respiratory issue. And if we didn't fix the CSF leak, then he could also develop subdurals and all this stuff in his brain. So it was a tough case, but we were able to tie off the fecal sac, realign his spine, stabilize him, and I mean he was obviously paralyzed. There was no recovering from that. But I think setting himself up, us helping him to kind of get set up for the best possible future, the best road to recovery. Again, it was not like the most heroic outcomes, but we really gave him the best chance he could, and I think sometimes that's all you can really do. But these are just a few of the experiences that I've had that have helped me down this path. When I feel frustrated or burnt out, I'm like, why am I doing this? I think about these cases, and we come back to this question: is medicine a ministry of healing? And I think it can be, right? It really depends on what you make it. I think you can get lost in the finite. You get lost in the bills and the notes. But if we remember that each interaction we have with a patient, they're typically going through one of the hardest things of their lives, the hardest times of their lives, and sometimes it is ultimately the hardest thing that they're ever going to do, the patients or their families. And if we can just treat that experience almost like a sacred experience, this opportunity to meet with them during a very difficult time in their lives, we have the opportunity to help them in this tremendous way, and that's very special. That's motivating. So I want to end with this quote. Does anyone mind reading that quote for me? Yeah.
The most important innovation in medicine to come in the next 10 years, the power of the human hand, to touch, to comfort, to diagnose, and to bring about treatment.
Love this quote. I love this quote because everyone's always like, oh yeah, we got the newest thing, we got the newest imaging, or the newest hardware, or the newest whatever. And technology's good, but nothing can replace the human aspect of what we do. And I think this picture here, the painting, epitomizes this perfectly. The doctor is looking at this child, and he is just 100% present. And I think if we can emulate that sort of focus and this sort of presence in our patient interactions, we will be a part of this ministry of healing. We'll be in touch with our core purpose, our why, and we'll help people. So that's all I have. Appreciate your time. So.